New York City dermatologist Dr. Doris rang the NASDAQ opening bell this morning to help kick off Melanoma Monday.
The reason, well, May is Skin Cancer Awareness Month. Dr. Day was joined by the president and CEO of MelaFind, a company that has developed new technology to help screen for melanoma.
Great.
And Dr. Day is joining us now.
Congratulations.
Good to see you this
Thank you.
evening. All right, so tell us about this device.
Yeah.
So the really sad news is that one person dies in this country every hour from melanoma, and there are 15 new diagnoses every hour of melanoma. So this is a condition that is the highest cancer killer in women 30 to 35 years old. So it's something we need to take very seriously.
Yes.
And we're working to help change behavior. I think, talking about this woman who tans so much has really increased awareness about the dangers of ultraviolet radiation and sun tanning. But it's really also about early detection. We know when we find melanoma early, you can have basically cure. When you find it late, there's almost nothing that you can do. We do have some new drugs, but really it's very difficult. So it's a matter of life and death.
Yes, of course. MelaFind, okay. Do you use that, by itself, or is it part of some other way of doing it so they can decide whether you need to do an biopsy or not?
MelaFind is a device that's been a very long time in the works. What it's done is, this is a device that used to take up a whole room as a big computer.
Yeah.
They looked at over 10,000 brown spots on the skin, basically did a scan, then did a biopsy, fed all that information into a computer, and the computer ultimately came up with a mathematical model by looking at so many, hundreds of different characteristics in wavelengths of light that we can't even see with the naked eye. And based on that, you can actually get a picture looking through the skin down to about 2.5 millimeters.
Wow.
So through the skin, and you get an answer of high or low morphologic disorder. So as a dermatologist, I still have to pick the spot. I see patients, typically they can have anywhere from 10 to 60 brown spots, moles, or birthmarks on their skin. So I'll evaluate with my eye with a dermatoscope, which is a special kind of a magnifier. The ones that are unimportant, I know they're unimportant. There are ones that are overly suspicious. I don't need MelaFind for that. But then there's ones that are questionable that I don't know which way to go.
So MelaFind is like a tool.
It's a great diagnostic tool. Doesn't take away the thinking, but it's one more outstanding diagnostic tool, and it's already made a difference in my practice.
Right.
So even before you get to the MelaFind stage, let's talk about this. A recent survey actually finds that about half of adults in this country don't even know how to look for it themselves.
That's
so
true.
Help us, Doc, because I don't think I have any idea.
Okay, so it's really important to look at yourself on a regular basis, and then on your birthday, have your birthday suit examined by your dermatologist.
Yeah, right.
So that's an easy way to remember.
You should do that at least once a year, right?
Once a year. And when you look at yourself, we have the simple A, B, C, D, E.
A, B, C, D, E.
So you look for brown spots, you look for asymmetry, so if it's different on one half or the other. B is for border, that's border irregularity. C is for color, so variations in color are important.
Right.
In your skin.
In your in the spot.
In the spot on your
and
skin.
then D is for diameter, so bigger than a pencil eraser head, if you still remember what a pencil looks like. And nobody uses those anymore.
But if anything is questionable, if you can remember, it's very difficult to do that, right? Because you're trying to remember, did it look that way 6 months ago?
If you have a doubt, you show your doctor, because they'll either reassure you or they'll remove it. And E would be for evolving. So if you're not sure if it was there, or if you're not sure if it looked just like that, that's a reason to show your dermatologist, because your skin's on the outside.
Right.
We can see this, we can catch it early. I had a woman who said her husband had vitiligo, which is a condition where you lose pigment, and he had a brown spot, and they just watched it. They were Dominican, so they were darker skinned. They thought they had no risk. And now he has metastatic melanoma. It could have been removed, and it's heartbeaking for us to see that.
And there are a lot of parts of the body, obviously you can't see, so someone else has to look at.
Yeah, so you can't see your own back.
Yeah.
But we also check out the scalp, behind the ears, between the fingers, between the toes. But MelaFind,
places that you wouldn't think about.
Where the sun doesn't shine. We have to look everywhere. But it's great and so exciting to have this as a first new diagnostic tool that will help us be more accurate in our diagnosis.
And so before we let you go, let me ask you really quickly, how much of a concern is this in children?
It's a concern at every age. Birthmarks that you're born with are not necessarily as problematic, but even in a child, if you see something new or changing, or if you have a personal or a family history of melanoma where it's in a first-degree relative, a parent or a sibling, your risk goes higher. Plus, melanoma can also occur in the eyes. So if you have a personal or direct family history of melanoma, you should also have your eyes checked.
That's why sunglasses are very important to protect your eyes.
So important.
Terrific.
And sunscreen as well. I mean, that's something that you have to think about every day.
Be sun smart.
Right.
Sunscreen, stay in the shade when you can, avoid midday sun. Even if you're indoors in a car, you still have to protect all wavelengths of UV light and tanning salons.
And all seasons, right?
all year
All
round.
season.
You are so informed.
I know.
love
I follow that
this.
very carefully.
Yeah.
That's
Dr.
great.
Doris.
Thank
By the
you.
way,
No, he's gotta be
congratulations
careful.
again, ringing the bell.
Congratulations.
Thank you.